born in Canada and went to undergraduate school in the University of Waterloo in Ontario. At that time, it wasn't really well defined in terms of athletic training versus physical therapy versus orthopedic surgery, so I didn't know which avenue to go through. And a friend of mine had recommended that I pursue a master's degree in physical therapy in the United States. I happened to be lucky enough to get into school at the University of Southern California. I also started to begin to teach at that time. From there I moved into private practice, and since then I've been part of the faculty of USC Physical Therapy, where we have an orthopedic residency program that we've had for now 4 years. I'm also involved in a lot of tendinopathy research with Dr. Cornelia Cooley. Well, I tried to do a talk when Dr. Fukuda asked me to speak. He wanted me to cover the essential injuries that are seen in the foot and ankle complex. So I decided that I wanted to make it fairly clinical. So I tried to hit on the basic biomechanics of the foot and ankle and each of the three functional components of the foot, the rear foot, the midfoot, the forefoot. And then of course discuss a little bit about how we evaluate that statically, dynamically. And then got into each section, each functional unit, discussing what are the major pathologies and issues that lead up to some of the things that we see, some of the diagnoses. For example, Achilles tendinopathy, lateral ankle sprain, hindfoot instability, in the midfoot, plantar fasciitis and midfoot instability, and in the forefoot, hallux limitus due to first ray instability. So it was kind of a technique where I was using, wanted to demonstrate certain manual therapy techniques that are employed in the clinic and are useful. And then of course applying taping to help fortify or stabilize the actual protocol that we've been applying, followed by a functional exercise that the patient is taught to hopefully retain that information and be able to incorporate that into their daily use. Well, it hasn't been exposed to as much in the United States as some of the other products that are out there, but we use, I think that their product line, what I've seen, is excellent. The use of vasopneumatic devices, suctioning tools that are used for tissue mobilization, their electrical stimulation, and of course the recent research with the Aussie stim, which is really used for neuromuscular electrical stimulation for strengthening, shows great promise. IBRAMED product line is very, very good, and I think that it should be very successful in the U.S. because the research that's following it substantiates its use.